So when you look at your experience, Jess, there's more and more healthcare professionals right now, especially in this time, where nurses, healthcare professionals who do not want to go back to the way they were practicing before. Right, we're getting into a place where everything. I mean, this COVID will change everything. Right, COVID-19 will change everything we're doing in healthcare practice as well. And so there are nurses, there are healthcare professionals who are literally saying, we don't want this anymore. We want to have a different way of integrating this in doing a different way of practicing. Now, you have been working with a physician, right, in Texas, who has been very successfully integrating Amare into his business. So I would love for you to share that story, if you can, about how that looked like, how that came about, and how that's looking right now. And then a little bit about moving forward is like, what does that look for the future, and how is this going to help this physician in particular, or other people, other healthcare professionals, other nurses who say, yeah, I want to be part of this movement, right? And I also want to do this remotely or as much as I can. Would you share a little bit about your experience, what you've done there?
Sure. And thank you for sharing all of that, Linda. It makes me want to, I feel the same way. And every time I hear somebody else say it, it makes me want to join all over again, because yeah, what we're doing here is so powerful. And it really is the missing link. And I believe that it's the missing link in our system, if you will. When it comes to healthcare professionals, yeah, we'll see after this pandemic, the shift. I think a lot of healthcare professionals are disillusioned, at least the Western medicine ones are disillusioned by not being able to really get to the root cause and help their patients beyond a pharmaceutical drug. So Dr. Martin is somebody that, comes to mind. He's somebody I work very closely with. And I'll never forget when I first started talking to him, he was like, morally, I can't do it anymore. I'm not really helping my patients. And so he was a traditional MD. Now he's moving his practice more to a functional medicine approach, focusing on nutrition and health. And so he gets it. And that's been really fun to work alongside him with that. And I think a lot of other healthcare providers are in the same boat. I know my mom is a nurse and has been for all of my life. And when she joined me in this business, she was like, I cannot do the sick care anymore. I want to be on the preventative side. And so I think a lot of people are seeing, all the numbers increase and all these statistics, right? And so what they're doing isn't working. And I'm not saying there's not a time and place for medication or any of that, but people aren't having better outcomes. They're not healthier, right? I mean, look at what's happening with this virus and who it's really affecting, right? It's affecting people that already, well, for the most part, that have pre-existing conditions that are largely preventable, right? So it's just interesting to watch. I think there's a big shift happening right now. And I think a lot of us are feeling like we don't want to go back to the way it was. So I do think there's going to be some aha moments coming out of this, and that, people are open to helping people live in the solution. Now, from an Amare perspective, I hear this over and over again, the $135 that the fundamentals cost, which is our gut-brain axis rebalancing system, is like $550 less than what I used to have to tell my patients to go to all these different stores to buy to do a gut healing protocol. And so that to me is exciting, right? It's like, how can we come in with this simple system and help people get to that root cause for an affordable price. And so before Amare, it was like, okay, you need to do all these things, which included an elimination diet and then shopping at 20 different stores. And by the time you added it all up, it was very costly, and most people can't afford that. Most people can't afford that. A, B, they can't even stick to the elimination diet, right? And so Amare eliminates all of that. And so that's been really cool to watch that light bulb come on when medical professionals see that this solves everything that they're trying to help their patients solve in just this simple system. So that's another thing that's really exciting. A lot of doctors are now shifting to a more gut health nutrition approach. And so we get to come in with this turnkey system and not only, have that value added for their clients, but also help them create this secondary income stream. So we've done that really successfully, especially in Dr. Martin's office. And he's one of the main MDs in the Abilene, Texas area.
Can you tell a little bit more about the flow, about how he has actually integrated that in simple ways, right? We don't, whatever you can say about that, but we'd love to hear about it.
Yeah, I mean, let's not overcomplicate it. So he came on board as a wellness partner. We got some workshops on the calendar, some balance your gut, improve your mental, physical health is literally what we've named them. You can copy the exact workshop name, the invite, and do it, and duplicate that. So we got some workshops going. We had really great response from the workshops. I mean, we usually sell out. There's 50 seats in his office that we're able to accommodate. And we usually sell, 70 or 80 tickets every time we do one. So people are really open and hungry for this information. And I would come up there and I would do the presenting for the first few, and now he does it with me. And so that's how we got this started. And of course, you follow up with everybody that came to the event, get them on products. We've created a private Facebook group for his patients. And we have, he's in there kind of supporting them all from a leveraged perspective, right? Has all the reboot information and things. So he also designated a Amare specific health coach in his office. And so that person I work very closely with to help her with recommendations and things for his clients, as I've had to help her ramp up. And so we have a simple document that's like, here's what to recommend for each health condition, if you will, without saying this cures anything, right? So we have a simple document that has that. And then what's really cool about what Dr. Martin has done is he has a patient success checklist, and he'll go in and meet with a patient and he'll check off this list, everything that they're looking to improve. So there's things on there like brain fog, anxiety, depression, digestive health, and it's this big list. And so he'll check everything off, and next to what he checks off, he'll put the product that he recommends, which is most of the time fundamentals or relief or mood or, whatever, sleep. And then he'll walk the patient into the health coach office with the sheet. And then that person sits down with the health coach that I work with.
I love it. I think it's so beautiful the way you've done it. Now I'm curious because this is fairly, it's been a couple of months now, I think, maybe 6-7 months. How has this gone for him? Has he gotten more clients? It's always the question, right? Are we getting more revenue in? Are we getting more clients? And I think he has more patients, right? But I'm curious about that.
Yeah. And in a little under like 4 months, we were generating another $2,000+ a month for his office. And of course, now we've moved away from the monthly in-person workshops and into the online workshops. And so we do one once a month. So yeah, this has been substantial. He also has energy and mood samples in all of the patient offices, right, or all the rooms. And yeah, we do a lot of promoting of Amare on his business Facebook page as well. So we work with his social media person to get all that leveraged onto his site. And of course, that isn't something we create. It's just all in the app that you get as part of being a wellness partner. So.
And where did you meet him, Jess?
Yeah. So I was going up to the Abilene area to launch one of our wellness partners. And I had a booth at an Orange Theory Fitness, and I never do booths, right? I never, ever, I don't like them, but I did it this time. And he came into the Orange Theory because he was partnering with them on some, specials, right, for his patients as well. And that's where I had met him. And the person who was hosting the launch event knew him as well and was reaching out to him to collaborate for Orange Theory things. So it worked out really, really well. And as soon as he walked up and he looked at what we were doing, he's like, this is what I need. This is the missing link in my office.
Nice.
And then he asked, is this network marketing? The question, he asked the question, and I said, yes. And he's like, awesome. I love network marketing.
See, that's the thing that most people don't understand. Same thing happened to me. I have my medical skincare clinic. Tina walked in 2009. She said, hey, have you heard about the DNA cheek swab that gives you customized nutrition and skincare? I said, no. And she said a couple other things. I said, is this network marketing? She stood tall and she said, yes, it is. I said, good, let's sit down and have a talk. I thought she was going to fall over. Anyway, nothing wrong with it. Great business model.
It really is the best. When people, to me, like, it's the smartest business model I've ever had the privilege of working in, right? I mean, all the other exchanging time for money that we're conditioned for doesn't make any sense to me anymore. I love this industry. And I think if you find the right company with the right values, with the right, the right relevant products, then yeah, it could be a great experience. So again, that's who we're looking for. We're looking for people that don't have any sort of hang up about it. And when they do, I feel bad for them. Like this, but I haven't had to get up to an alarm clock in 11 years. Like,
I love it, Jess. Where do you see this going for Dr. Martin? I mean, is it expanding? I mean, I know the Facebook group is working really well, right? I think he's very happy with the results. Patients are happy. Tell me where do you see it going for him?
Well, it's funny that you say that because we were talking yesterday and he's like, I'm ready to bring on strategic wellness partners and really focus there. So, and he says that often, like he sees the bigger vision with this. He has 6 kids, he's a single dad type of a thing. So he's really overextended. And I think, as he's seeing his patients get really great results with this is another way he can impact and continue his legacy with his career. So he wants to take his whole business, more online and more telemedicine anyway. So this is just one income stream in there, but he's very serious about it and excited about it.
Awesome. How would you approach other people, other healthcare professionals with this? I mean, any kind of specific ways you would say this to other healthcare?
Again, I like the strategic partners. I like that phrase. It feels good coming. I was just looking in the Level Up Leadership, and I do have some wording in there. And some wording that I really like to do is, especially for like a more functional medicine or a naturopath or a health and wellness coach, I'll say something like, what we are doing to combine Ayurvedic and ancient Chinese medicine with the latest science around the gut-brain axis and coupling it with natural mental wellness modalities is really powerful. Yeah. And so that's probably some wording I would continue to use. That's actually in the group.
Awesome. Thank you. And I guess moving forward now to the whole programs that we have now on as well, right? I think that's very exciting. We have now mindfulness programs, mental wellness diet programs. We have beautiful movement programs, right? That's also accessible for everybody who signs up as a customer for $24.95, right? So you want to talk a little about that, how to integrate that with what people are doing. I guess this is a beautiful way to integrate that too, right?
Yeah, I mean, from a modalities perspective, it's so needed when it comes to mental wellness, right? This isn't one thing fixes all. I thought maybe when I quit drinking back 6 years ago that would fix everything, but no, it required mindfulness. It required getting, this gut-brain axis optimized. It required me, doing a movement, exercise program that felt good. There's so many modalities, and I love what Amare is doing to bring them all together, because it's not just one thing that leads to optimum health. It's so many factors. And so to help people to see that bigger picture, and Dr. Martin, actually, he was like, oh my gosh, the programs they just came out with, it was exactly what I was thinking I wanted to start promoting. So he started promoting those all on his Facebook page. He's like, this is amazing. I was just thinking I needed to hire a yoga instructor for my clients, and now I don't have to do that. Right. So, yeah, it's super unique what we're doing in terms of all these, bringing together all the things needed for optimal mental and physical health. And that's an exciting thing to be a part of, because I think, we've tried these one-off fixes, right? I mean, that's what an SSRI is, right? It's like, here's a pill without any other modalities, right? And here we get to bring all of them together in a holistic way.
Hi, Jess.
Yeah.
Mindy. It's Mindy. Hi. So question, how does it's Dr. Martin, right? How does Dr. Martin do it? I have a brother who is a nurse practitioner doctor, and he's also studied the integrative medicine. And when I approached him about Amare, he looked at me, he goes, oh, this looks great. But I said, you could suggest this to your people. And he's like, no, I can't. Legally, I can't do that. So how is Dr. Martin doing it so it's legal? Is it because it's his own practice, or because that checklist that you said he went through, I go, oh, I'd love to get a hold of that, because then I could say, hey, there's a basic checklist, and I would know the things to kind of name on it. Because I have multiple siblings in the medical field, and I have connections to people that it would be awesome if they had that, if I could point them to that so that they could look at that model and pull from that, not just me talking. I have no relevance to them. you know, yeah, who are you? What's your degree in? But I know the information, and being able to point them to Dr. Martin and point them to that and say, hey, you know, how could that work?
So a couple points there. There's a folder that we have out on Dropbox for our team Dropbox that has all the information in there that I'm actually reading off of right now. So it's all documents that we've put together for this process. So I've taken the time to document it. So that's available to you. The checklist, the process, the
Where do I find that? Same on the same Level Up Leadership?
We'll find you. Yeah, we'll send you all that.
it's
Okay.
not in Level Up Leadership, although I guess it could be. It's out on my Dropbox folder because it's a bunch of files. So Anna Marie, if you want to add her, let me know. And then, so it depends. I mean, each state is different. So if a doctor works for some sort of an umbrella system, then a lot of times they can't do anything like this, right? It all has to come from the top down. Dr. Martin runs his own, family
Yeah, a
practice.
couple of them I'm thinking of do have their own practice, and they already do integrative medicine and whatnot.
Yeah.
But it would just be a much easier sell, for lack of a better word, if I could point them towards somebody who is already doing it and the
Yeah.
method they're using.
Yeah. Well,
Absolutely.
if they have their own practice, then yeah, it's just a matter of do they resonate? Do they see this as value add for their clients? And a lot of doctors are starting to, because it's the national conversation right now, right? I mean, before this, every other article was around the gut and the gut brain connection and or mental health issues, right? So
Can I
The
add
other thing
something?
have to, it's also, and then let's also look at what you think the future is for this. And then we'll go to questions. Okay, guys, I would love to.
Can I just add something, Anna Marie?
Yeah.
When Mindy was asking, or she made a statement, well, who am I? What's your degree? Just realize that really doesn't matter. If you've got a prospect, just do just a drop to open the door, and then bring in someone like Jess or Anna Marie to help you through that process. And that's what this is. We're a team. So don't think that you don't have, the ability to work with someone like that and use the tools. And we're part of the tool chest,
No, I
right?
love it. Yeah, absolutely. Yeah, absolutely. I love that, Linda. And another thought I always have is the way you, as a physician, work or as a nurse work, you go into the health piece, right? To optimize health. We're not curing, we're optimizing health. So that's always from a professional standpoint of view, you optimize. The other thing I always say to people who are nurses or healthcare providers, you have a whole entire network of people, right, who are not your patients and that you could easily reach out to as well. So that's just another thought that I have. I'm curious, and then we'll do more questions. Jess, as you are seeing the future is moving forward, what would be your recommendation as you're having a nurse or a healthcare provider who is either listening to this later on and they're saying, wow, this sounds kind of interesting. What would be your tip to kind of get started? What do you think is that? What's the first step for them?
Well, I think the first step is like getting the products in your body and being able to experience them. And then that's all this business is sharing your experience. I know we want to overcomplicate this or think we have to have some, fancy degrees, and I have no background in this industry. So thank you for sharing what you did, Linda, to help Mindy, because so true. I mean, my degrees in technology don't apply to this at all. And I don't have a health coach degree. I don't have any of it. And I've been very mindful not to get those because I don't want people to think they need all these certifications in order to do this. Like anybody can do it. You just use the tools. And that's the good news. So get the products in your body, have that experience to some extent, and then let's get out and start sharing this. And then you just use the tools. You plug people into the systems we already have. Like you don't have to explain anything. You don't need to be the expert on gut brain access and neurotransmitter signaling optimization. Like you don't need to know any of that. You share videos that Dr. Sean, our chief science officer, has already created for us. You plug them into, webinars that him and Pat do every night of the week. And then all we're here for, and what we can really add value in is helping you bring them on board and helping them get moving. So don't overcomplicate this.
Right, and just get started. I have one question more, and that is probably for some nurses, and that it's something I'm going to hear. I'd love to hear your answer to that, and I think I might know it, but I'm curious. So there are nurses who are making significant money, right, with doing what they're doing, right, and yet they're tired of the systems that they're working in because they're tired. They're tired of because. But I know I see nurses, right, who make good money doing that. What would you say to them? How would they kind of transform from where they are right now to where they want to go, and why would they do that? What would be your tip towards them? Same, probably the same, but I don't know if there's something different in there.
Well, I think, we experience marker moments in our life that change everything for us. And I know for me, there was 3 back-to-back marker moments that really put that light bulb on in my head that said, I want more. I want to make a bigger impact. I want to do something that's tied to leaving this world a better place. And that wasn't happening at my job. And so when that became more of a pull than the income I was making, then, I really just figured it out. And that's when I was like, okay, if I can build up to, $1,000 a month, and I know how to, 2x that, 3x that, 10x that, and replace my income. And there's something so powerful about creating an income stream that you've done all yourself, that nobody can dictate. I don't know about you guys, but in corporate America, I was getting 3% raises if I was lucky. And somebody dictated that based on a pie, and we all fought over it, right? And so there's something so powerful about this industry and being able to dictate your own time and your own worth. And then Amare comes to the market with not only, category creating relevant mental wellness products, but also a guaranteed income program. And I capitalized on that program as soon as they launched it. I mean, it was so fun. And that's how I replaced a career income. And I was at $150,000 a year back in 2009 when I left my corporate job, and I was able to recreate that very quickly at Amare. But was that a lot of hard work? Yeah, I mean, that did not fall out of the sky, but I am so passionate about this mission that, nothing stops me from sharing it. And if people aren't receptive, then I feel bad for them. I'm like, oh my gosh, this could really solve all your problems. So.
Well, thank you for saying that, because I think making that impact, right, and also long-term the income that we can, but also then having a different way of functioning as nurses, as healthcare providers, right, making a big difference. I think Dr. Mark Hyman actually said it the strongest. He said, I cannot fix what I need to fix from my office doing what I do right now. I need to go bigger than that, right? And I think that's what we're doing, and we're leveraging, and we're going to all that together and making that happen together. So thanks so much for your time, girl. I'm going to actually just ask anybody else if they have any questions or anything that they want to add to this, because I think it's been a phenomenal conversation. But thank you. Anybody has any questions? I'd love to hear any more.
No, thank you, everyone.